Hey guys, my name is Yuya. As you can see from the intro, I finally graduated from dental school. So it's been a long time coming. It's been a long 4 years. There were ups and downs. And we're very grateful to be able to call McGill my home for the past 4 years. I definitely grew a lot as a clinician, but also as a person. But now comes the big question, what is next? Should I be jumping straight into private practice, or should I be doing a residency, whether it's a GPR or AGD? Or should I go into specialty? Those are all the different options that someone may be thinking. And hopefully in this video, I'll be able to break down the pros and cons for each and every single option. So that way you'll be able to make a good decision as to what you want in your future as a pre-dental student, a dental student, or even as a dentist. So first and foremost, it is the private clinic. You'll be seeing your own patients. You're going to have your own autonomy, being able to choose your own schedule. And of course, with 4 years dental school, you have accumulated a lot of debts. So that's why you may choose to go into private practice, to be able to have a higher earning and to be able to pay your debts off as soon as possible. And this is as an associate, but you can also choose to open your own clinic to become a clinic owner. I think the downside of going straight into private practice as a recent grad is there'll be a steep learning curve. So from dental school, you see around like 4 to 5 patients a day. And once you get into private practice, you can be seeing double the amount of patients. And that's not including the exams that you have to do for your hygienist. So it's also very important for you to find a good mentor, so that way you're able to grow as a clinician while also having someone to back you up whenever there's any difficult situation that may arise, some procedures that you're not too sure of. If you feel ready to tackle the world, for sure this is a good option for you to do so. But if you want to gain more experience before you go into private practice, there are 2 ways that you can do it. First path is a GPR, which is a general practice residency, or you can choose to do an AGD, which is an advanced education in general dentistry. Let's talk about what's a general practice residency or GPR. So first, it's basically doing your 1-year residency at a hospital-based program. The patients that you'll be seeing are mainly medically compromised patients or just patients with complex medical history. So that can be oncology patients, cardiac patients, or just any immunocompromised patients. And you're also gonna have the chance of dealing with emergency patients. So anyone who comes in with trauma, infection. It's also very important to know that you're going to have different rotations. It really depends on each and every single program, but a lot of them will have anesthesia rotations where you're going to be learning how to intubate. It's also a way for you to work in an interdisciplinary team. So you're going to be working with physicians, we're going to be working with PT, OT, speech. And depending on which program you apply to, some may have advanced procedures, which will allow you to place implants, do IV sedation, or even do a lot of surgical extractions. I think the main downside is that you're going to be in a very fast-paced environment where there's going to be a lot of medically compromised patients. So there's a lot of things to think about, their conditions, what can you do, what can you not do, what are the different contraindications of your patients, and also you're going to be on call. So it can be overnight calls or weekend calls. Whenever there's a patient that shows up at the emergency and requires any dental attention, then you'll be called and you would have to go in and assess these patients and do the treatments based on your diagnosis. It's also very important to note that you'll be paid less than if you were to go into private practice. But however, you do get a stipend or a salary so it can cover for your daily life expenses. So most GPRs are 1 year, but some may choose to do 2 years. So those 2 years, they can become the chief resident and they'll be dealing with much more responsibilities and doing much more procedures. So all in all, GPR, you're going to be dealing with a lot of complex cases at the hospital, but you're going to be getting a lot more experience regarding the different traumas, emergencies, and also the different procedures that may be taught at your program. And then now comes the AGD, the Advanced Education in General Dentistry. So in contrary to GPRs, you're not going to be at a hospital. You're mainly going to be working in a clinic associated with a school. So you're going to be doing more bread and butter dentistry, operative, crowns, bridge, dentures. But also you're going to be doing some perio surgeries, endos, and that really all depends on which program you apply to. Some programs may have more than others. While doing all these these procedures, you're going to have different supervisors or specialists that are going to be there with you if you ever do need help. So it's a bit similar to dental school where you're going to be assigned patients, but then you have way more freedom, way more autonomy as to what kind of procedures that you may want. But for sure, that really depends on what are the patient's needs. As an AGD, you're also going to be receiving a lot of continuing education, so whether it's implants, whether it's how to do harder endos. At the end of the day, you're going to become more confident in the different things that you can do as a dentist. It's very similar to the GPR situation. You're going to be paid less than if you were to choose to go into private practice. Since it's not in a hospital setting, you're going to be seeing a bit less trauma, less infection, but that does not mean that you won't be seeing any. Quantity will be way less than if you were at a hospital setting because of the population that you'll be seeing. Still 1 year, and some people may choose to do a second year. So just a side note, from what we've been told by professors in dental school, 1 year of GPR or AGD equals to around like 3 to 5 years of private practice. Once again, that really depends on which program you go to. But at the end of the day, it's what you make out of your residency program that's going to shape what you want to become as a dentist. All in all, doing an AGD after your dental school will allow you to become more confident, and it's going to allow you to sharpen your clinical skills, whether it's doing procedures or patient management. Just a little disclaimer, I realized I forgot to mention this video, but AGD's programs are only offered in the United States. If you're a Canadian student interested in pursuing an AGD, then you would need to relocate to the States to complete one. Last but not least, specialty training. If you want to know more about the different specialties out there, you can click on this video where I kind of explain a bit what are the recognized specialty programs in Canada. So if there's something that you really like to do, that's really something that you want to do for the rest of your life, this may be an option for you. I think it's really important to know about what you really like in dentistry or what you don't like in dentistry, because if you do become a specialist, most of the time you're going to be doing things that are related to the specialty programs that you decided. So it's really going to narrow the scope of practice that you're going to be doing. You're going to be doing way less general dentistry because you're going to become an expert in your own domain. So whether it's ortho, whether it's ORMFS, whether it's radial, prosto, you'll be doing a lot of procedures that are dedicated to your own specialty. As a specialist, you're going to be able to charge a bit more compared to a general dentist because you've done additional training to perfect your craft in this discipline. And depending on which specialty you choose, it can be a time commitment. So it can be as short as 2 years up until 6 years. And to become a specialist, the process is very competitive because there's only so many schools out there, and all the ones who are applying to are also going to be very good applicants. Those are the different stresses that you may have to endure whenever you're applying to those specialty programs. Another downside is that you'll be collecting more debts. So most specialty programs do not pay you. So you won't get any stipends, you won't get any bursaries or any salaries. Of course, there are some exceptions here and there. Please consult the websites of the different programs that you're applying to. Some may say that you're going to be receiving a stipend. Others may say that you're mainly going to be paying tuition. And because it's very competitive, you may have to relocate to be able to do your specialty program. So all in all, as a specialist, you're going to be an expert in certain domain. And that's mainly what you're going to be doing for the rest of your life if you do choose to become a specialist. I think it's very important for you to figure out what you like, what you don't like about dentistry, and that way you're able to narrow down if you do want to become a specialist or not. So those are the different clinical options that you may choose from. If you choose to be more academia focused, so whether you want to teach or whether you want to do more research, you will just need to be able to contact the different schools, see if there are different opportunities for you to be taking up those roles. So at the end of the day, what should you choose? I think that really depends on a lot of things. It depends on your career goals, on your personality, and the lifestyle that you want in the future. So some thrive in private practice right away, while others value a bit extra training before jumping into private practice. So what is my advice? Go shadow, whether it's general dentist, whether it's specialist, talk to different mentors or upperclassmen that have gone through either a specialty or AGD or GPR programs that you're interested in. But the most important thing is to think about what excites you the most about dentistry. If you like this video, don't forget to drop a like, subscribe for more content about dentistry. But also, it's very important for you to let me know in the comments down below what you would like to see next. And that's it for me today. I'll see you guys in the next one. Peace.